Hello, my name is Shanna Ines, and welcome to my presentation. Today, I am going to start off talking about regulatory accreditation and organizational compliance related to healthcare management in Canada. The next topic I'm going to discuss includes five critical elements that promote patient safety. And then lastly, I'm going to look at quality and how quality in healthcare can reduce costs. So let's get started. So, when it comes to the Canadian healthcare system, it is publicly funded by taxation, and the organizations are required to maintain regulatory compliance through different legislations, both federal and provincial. So, organizations are also required to be accredited through Accreditation Canada, and the goal is to achieve the highest standard, which is exemplary standing, which means that the organization has exceeded the basic requirements needed to maintain accreditation. So, healthcare managers are responsible for ensuring that their departments meet legislative requirements that apply to them. So, this can include the Canada Health Act, the People's Healthcare Act, the Excellent Care for All Act, the Public Hospitals Act, the Occupational Health and Safety Act, the Freedom of Information and Protection of Privacy Act, the Personal Health Information Protection Act, and the Fixing Long Term Care Act. And so, healthcare compliance programs must ensure that they're meeting all the legislation and accreditation requirements. And so, in addition, Ontario hospitals, which is a province in Canada, must meet quality improvement standards through an organization called Health Quality Ontario, which provides health quality standards for organizations to meet. And these legislative and quality standards support best practices that promote client safety. So, compliance within healthcare should promote ethical standards and legal rules by ensuring that the staff um, follow the code of conduct and the code of ethics, and that the care that they're providing are in alignment with the legal requirements and the regulations that are set by the government. And the managers also must ensure that their department policies and procedures reflect these code of conducts and code of ethics, as well as the regulations set out by both the federal and provincial governments, and then accreditation standards as well. So, when considering patient safety, the biggest critical elements include communication, teamwork, continuous quality improvement, staff education, and policies and procedures. Um, and so, clear communication among healthcare professionals ensures that information about patient care is accurately shared, understood, and then this also helps in minimizing the risk of errors and enhancing coordination of care. Teamwork helps in fostering a collaborative approach to patient care, allowing for diverse perspectives and collective problem solving. Um, when considering quality improvement, different processes help proactively identify and address potential safety issues, ensuring that care practices are always evolving and improving. Um, and so this really helps in supporting and making sure that staff are implementing best practices. You're always striving to identify gaps and see where you can make the process better. So that's a really important part of patient safety. Next is regular staff education, and this helps keep healthcare professionals updated on best practices, emerging protocols, and new technologies, which help maintain high standards of care. Um, Lastly, comprehensive policies and procedures provide a structured framework for safe practice, and it also offers guidelines that help prevent errors and standardized responses to potentially safety incidents that happen. So, altogether, these elements create a robust system that prioritizes patient safety, promotes high quality care, and supports a culture of accountability and excellence. So, the next topic we are going to talk about is quality and costs. So, quality can act as a guiding principle for controlling healthcare costs by delivering effective, efficient, patient centered care. When organizations prioritize quality, they aim to enhance patient outcomes and reduce errors, which can lead to significant cost savings. High quality care often involves implementing evidence based practices, improving processes, and reducing unnecessary interventions, all of which can prevent costly complications and readmissions. So by investing in preventative care and early intervention, organizations can reduce the need for more expensive treatments and manage chronic conditions more effectively. Additionally, a focus on quality encourages the use of data-driven approaches to gaps and assists with standardizing procedures that can assist in controlling costs. And so ultimately, by aligning efforts with quality principles, healthcare organizations can achieve better patient outcomes, leading to a more sustainable and cost effective healthcare system. So, I just want to talk quickly about medication errors. Um, Medication incidents are the first critical area to focus on related to patient safety. Medication incidents can occur due to many different factors, and preventing them is important in protecting patients and making sure that there's no serious adverse events that occur. Um, and so, factors that lead to medication incidents include issues with the product, package, or label, professional practice issues, and improper procedures or systems, which encompass describe prescribing, dispensing, distributing, administering, monitoring, education, or communication. So, healthcare leaders must implement policies and procedures that safeguard patients against medication incidents. This could include double checks for high alert medications, ensuring that nurses follow practice standards of the College of Nurses of Ontario's medication guide, and this will ensure that nurses know best practices related to medication administration, and it also is helpful for nurses to report these incidents so healthcare leaders can look over the incident and understand what happened in order to prevent it from happening again. Another patient safety concern is patient falls. And so falls can be really costly to the healthcare system, especially since in Canada we have a publicly funded system. Um, the dollars can add up quick. It's not paid by insurance, and it's paid um, by taxation. So a recent study showed that the cost of a fall is around $62,521. It's really important to prevent falls, and so healthcare managers can focus on preventing falls through staff education, different policies and procedures, um, quality management strategies, and then also post fall debriefs so the staff can discuss what happened and how to prevent it in the future. The last patient safety aspect that I wanted to talk about is patient abuse and violence. So, patient safety is a fundamental aspect of healthcare that includes safeguarding patients from abuse and violence. So, ensuring a safe patient environment involves implementing strict protocols and training to recognize and address any mistreatment or aggressions. Prevention intervention strategies are imperative in preventing abuse of patients, specifically older adults. So, when healthcare settings prioritize patient safety, they create a culture of respect and vigilance where patients are protected from physical, emotional, or psychological harm. This proactive approach upholds the ethical standards of care and enhances the overall quality of care by fostering trust and promoting a supportive environment. By actively preventing abuse and violence, healthcare providers ensure that patients receive the care they need without fear or harm, ultimately leading to better healthcare outcomes and a more compassionate healthcare experience for the client. So, thank you so much for joining me today. I hope this presentation has provided valuable insight into the essential components of healthcare management and strategies necessary for promoting safety and controlling costs. If you have any questions, please feel free to reach out to me. You can reach out to me by email at sswong@lakeheadu.ca. Thank you.